Good afternoon. My name is Brian Gromkowski. I'm one of the assistant directors of graduate admissions at William Patterson University. I want to thank you for taking time to join us for our webinar today about our WP online graduate programs we have within the School of Nursing. I'm joined here by Dr. Hollema, who's going to speak at length about the online offerings that we have in just a moment. And just wanted to go over a couple quick things before I pass it along to her. First, I want to make sure you know we are going to be recording this presentation in its entirety. I know schedules can be a little bit chaotic right now. Some things can be unpredictable. You may have to duck out partway through the presentation, and we want you to have every opportunity to go back to any information you might miss or need to catch up on, anything that was helpful that you might want to review again. So you will be getting email from our office before the end of the week that will include a direct link to the YouTube channel presentation. We will have the recording. So do be on the lookout for that. And if there's any colleagues or others who might benefit from the opportunity to hear this presentation, certainly we'd love if you'd be willing to share. The other thing is, if you have any questions as we go through, feel free to type them in the chat box there on the GoToWebinar screen. Certainly it's our hope that all of your questions will be answered for the presentation, but we know sometimes there's very case-specific questions that might pop up. You may have some admissions questions or otherwise. If it's something quick that we can answer, we'll just type you a quick answer in the chat box there. If it's something that would be a benefit to read off to the full audience, we'll do so at the end of the presentation. So just keep that in mind as well. But certainly I know you're not here to listen to me talk. You want to hear what Dr. Hollema has to say. So without further ado, Dr. Hollema, take it away.
Hi, I'd like to welcome everybody to our presentation today and to our new WP online MSN program and Postmaster certification program. What I would like to do is just sort of give you an overview of what the program is. And as Brian said at the end, if you have any questions, we will answer those questions at the end. All right, there are 4 major MSN concentrations or tracks within our master's graduate online program. One is the nursing administration, which is a total of 31 credits. If you go full-time, it's 10 months, and if you go part-time, you can complete it in 20 months. And I'll talk a little bit about what the overview and time frame will be. Nursing education concentration is 35 credits, and you can complete that in 12 months full-time and 22 months part-time. Our adult gerontology nurse practitioner in primary care is 39 credits, and that can be completed in 16 months or 24 months part-time. And then our last concentration is the family nurse practitioner. Sorry, I must have hit that by mistake. That's 47 credits, and that can be completed in 20 months and full-time and 28 months in part-time. Our master's programs are accredited by the CCNE, and that accreditation goes through January 30th of 2030. Our Postmaster certificate is also accredited through that time, and also we have a Doctor of Nursing Practice, which is accredited at that time. That presently is not online. The program's designed really for professional registered nurses who have completed a master's degree in nursing and is interested in really going into a certification for advanced nursing practice or administration or education. The Department of Nursing currently offers a Postmaster certificate also in nursing administration, education, adult gerontology practitioner in primary care, and the family nurse practitioner. Students in the Postmaster certificate program complete the necessary theory and practicum and course requirements within the track according to a gap analysis. What happens basically is those Postmaster certificate program students have completed their master's in nursing in another field or concentrations. Some may be in education, some may be in administration, and now say they want to come and do their Postmaster's HMP or family nurse practitioner. So what happens is you then submit your transcripts and they will review them, and then I will let you know what courses you will need to take to complete your certification. in the Postmasters. And that's really what that gap analysis is. It can be individualized depending on the student and what courses you may need to take. The requirements for admission into our MSN program is really a valid RN license that's unencumbered in the state in which you practice. So you don't have to reside within New Jersey. However, there may be some restrictions depending on what state you reside in as they apply to the clinical hours that you would need to take with the practicum courses at the end of the program. And that I'll talk a little bit more about. You also need a BSM transcript with a minimum of 3.0 GPA is required. However, we will review applicants that may have, I'm sorry, I don't know why this is going on, that may have a GPA that is less than a 3.0. And what we require then is that you need to take the first 1 to 2 graduate courses and then receive a 3.0 average on those courses to remain in the program. In addition, undergraduate prerequisite courses in statistics, health assessment, and nursing research are required. If for some reason you may not have an undergraduate statistics course, that needs to be taken prior. We need 2 names of reference, either from a formal faculty or a current manager or supervisor. They don't need to send in a letter, just so that we have their contacts in case we feel that we would like to contact them. We have your approval for that. And in addition to that, 1 year of RN working experience. Students, as I said before, that are admitted based on a program coordinator review with a BSN below a 3.0 are required, as I said, to take the 1 to 2 graduate nursing courses and earn a B or better in order to continue in the program. And as I said, any students missing prerequisites may be admitted with the condition that the prerequisites will be completed within that first academic year, such as what I said with the undergraduate statistics course. Also, Postmaster's admission requirements are a little different, but relatively the same. You need a resume, your MSN degree with official graduate nurse transcripts, an active unencumbered RN license in the state in which you are practicing. So such as, say that you were in Delaware and you are residing and working in Delaware, then your RN license in Delaware needs to be active and unencumbered. 1 year of RN work experience and a minimum of a 3.0 GPA. Important clinical requirements that we'd like to point out is that you need to maintain a valid and unencumbered RN license in the state in which you practice for the duration of the program. And you need to notify the program coordinator, which was myself, if you intend to move out of state with which you hold your RN license. And the reason for that is, an example would be New York State. Presently, we don't have approval for our students within the program to practice their clinical hours in New York State. However, you can come into the program and then you agree that if we don't have approval by the time you start your clinical hours or your practicums, that you agree to obtain a New Jersey RN license and then do your clinical hours in the state of New Jersey. So that's what we mean by moving out of state, because there are some states in which we don't have approval for you to do your clinical there. And that's what we want to be aware of so that we can have a plan going forward. Tuition for 2020-2021 for the MS program for the administrative track is $530 a credit. The education is $655 a credit. And the adult gerontology nurse practitioner and primary care is $665. The family nurse practitioner is $720 a credit. A little different for the Postmaster certificate a bit. The administration is $443 a credit. The education is $525 and the AGNP $542 and the FNP $597. So these are have been decided overall for the market value across the United States. There are no additional fees for the program itself. Program delivery, for the most part, is we want to try to make it as easy as possible and accessible, because we know that mostly everyone is either working part-time or most are working full-time and have a family life, personal life, and with everything going on in the world. So we make it as flexible as possible. All the classes are asynchronous, meaning that there is no time or date in which you have to be online. That does not say that there are coursework and assignments that will have due dates in relationship to that. But the courses are asynchronous and not synchronous. The program runs fall, spring, and summer, and all the semester courses are 7 weeks with 1 week off and 7 weeks. So what will happen is, if someone is starting the program, say this fall, they are part-time, they will take one course the first 7 weeks. They will then have a week off, and then they will take in their next course the next 7 weeks. For those who may want to do full-time, you would take 2 courses the first 7 weeks with a week off, and then 2 courses the next 7 weeks. We make it flexible too, that if for some reason something may happen, and say you start full-time and you find that that next semester you might not be able to take the 2 courses within the 7 weeks, you know, we can discuss that, and you can take 1 courses, and then you can bump up to the 2 courses if you need to. So it is flexible, and we want to really work with you because we know life happens. Also, as far as self-guided lesson modules, there will be modules for each week, 1 through 7, which course content, in addition to assignments that will be assigned and due with due dates. We also use streaming video, virtual library, social media platforms, and also hands-on learning too, and that's related to really your clinical or practicum courses, which you will be with a preceptor at that time. Preparation, for the most part, we really want you to have a good experience, guided clinical practice experiences. There will be faculty and preceptor, the faculty within the course themselves, the didactic component, and then you also, toward the end, will obtain a preceptor, and we will assist with that. There are many times that students have preceptors in mind, and that's perfectly fine. But if you find that you're having difficulty finding a preceptor, or we are certainly here to assist, and we are going to have a clinical coordinator that will assist with that and help you with your clinical practicum questions or any issues that you might have. Once you are finished with our program and graduate, you will be able to take your certification exam and preparation. Nationally recognized exams, usually students will take the ANCC, the American Nurses Credentialing Center certification for the adult nurse practitioner, adult geri nurse practitioner, or the family nurse practitioner. Or you can take the AANC, the American Academy of Nurse Practitioners, for both of those. Those that may come in and do an administration concentration can take the Nurse Education Certification Exam and or the Certified Nurse Educator for our Educator concentration. So those are all certification exams that can be taken at the end. The MSN curriculum, there are core courses that will go through whether you are coming into the education or the administration or the AGNP or family nurse practitioner. The core courses are our theoretical foundations of nursing, the role of the advanced practice nurse, population health, which goes over health legislation and social policy, nursing research, and then for the clinical courses, the Advanced Nursing Practicum 1, which is 6041, and then there are specific Advanced Nursing Role Practicum credits. 7252 is for the AGNP, 7253 is for the Family Nurse Practitioner, and 7254 is for the Administrative, and 7255 is for the Educator. We want you to have the role practicum within the context of that concentration. That's why that last practicum course is divided that way. Nursing administration is 31 credits as far as that concentration. As I said, there are the core courses that we spoke about, and then there's graduate core courses, plus healthcare data analysis, principles of nursing administration, financial management, and then the last practicum, the advanced nursing role practicum. Now, because it is nursing administration, we are also working with the accounting and the management concentration. So you will then take courses in accounting, fundamentals of management, marketing, economic analysis, finance, and business statistics. And if you look at those courses within the College of Business, they're 1.5 credits each. So they are mini courses that then will give you that area that you need for your nursing administration for the total of 31 credits. Nursing education, as I said before, is 35 credits. You will take the graduate core credits courses that I had spoke about before, in addition to the advanced pathophysiology, advanced health assessment, and advanced pharmacology, curriculum development, classroom teaching strategies, and clinical teaching strategies. Now, I know you say, I'm doing nursing education, and why do I need to take advanced patho, advanced health assessment, or pharmacology? Those courses, what we call the 3 Ps, are now mandated by the crediting bodies. So that's why they are there. The adult gerontology nurse practitioner in primary care is 39 credits, and you will then take the core courses that we spoke about, in addition to your advanced patho, the health assessment of the adults, and the advanced pharmacology. In addition to that, you're going to take your advanced practice nursing, which basically is the core foundations for the theory, and 6121 is the Advanced Practice Nursing 2. Those are the 2 content-based courses. Then, in addition, you will take an additional practicum course, 7011, in addition to the first one, 6041, and then the role practicum, for a total of 39 credits. Now, each of the practicum courses are 170 hours. The family nurse practitioner is 47 credits, and that includes your core courses in addition to your 3 Ps, as I said, your pathophysiology, health assessment, and pharmacology. Now, you will then take your adult core courses for the theory, the Advanced Nursing Practice 1 and Advanced Nursing Practice 2. Now, in addition to that, you will then take the pediatric and the obstetric core curriculum, which is 6130, which is 3 credits. And then you have an additional practicum course, 7070, which is the Advanced Nursing Practicum 3. That includes 170 hours, but the total breakdown within that is 120 hours of pediatrics and 50 hours of obstetric clinical hours. Now, for anyone who is in the education track, I just want to point out that there is a financial program, loan program, a federally funded program. It's called the Nurse Faculty Loan Program. And it's a federal program that's designed to increase the number of nursing students who pursue careers as nursing faculty full-time in schools of nursing. You need to be full-time or part-time. And part-time, we did find out, part-time includes one course for the first 6 weeks and one course for the second 6 weeks. So if you are part-time and you're taking one course for each of those sessions, you would be eligible. What it basically is up to 85% of the total loan amount will be forgiven if the graduate works full-time for 4 years after they graduate in a nurse faculty position within 12 months upon graduation. The faculty positions may be in any state and in any accredited nursing program. It could be an associate, a bachelor's, master's, doctorate, or a PhD. Students need to be matriculated and enrolled in 6 credits for the requirements. So those 6 credits, as I said, within that semester can be 3 credits for one session, first session, and the second session of the semester, the additional. If you are interested in the program, you can call financial aid, but you can, the program director for that is Dr. Kim Louie, and her information is to end of the presentation. I think it may be the next slide. All right, so if you have any questions that you may think of that we may not answer at this presentation or at the end with questions, you certainly can contact me at any time, Dr. Cheryl Hollema. My email is hollemac@wpunj.edu. I know my phone number is there. We're kind of not in the office as much with doing with COVID and stuff, so preferably email me, and I usually will get back to you within 24 hours. As I said, Dr. Kim Louie is the program director of the department, the graduate director, and if you are interested in that faculty loan, please contact her at louiek@wpunj.edu, and she can give you the information on that. I want to thank you all for attending this presentation, and if you have any questions, I'm going to turn it over to Brian.
Thank you very much, Dr. Hollema. First, we did have one question come through, but I'm just going to do a couple quick housekeeping items before we jump into this question and any others that might come through. For anybody who may have joined us a few minutes late, I just want to make sure you know we did record this presentation in its entirety, and we are going to be sending you an email before the end of the week that includes a link to our YouTube channel, so you'd have the opportunity to catch up on any of the slides that you may have missed. If you do have any questions, feel free to type them in the chat box there on the GoToWebinar screen. Either one of us in Graduate Admissions or Dr. Hollema can field your question. But we do have one that came through. So Dr. Hollema, one question for you from a student is, if you are currently in the undergrad nursing program at William Patterson, do you have to stop schooling in order to work for a year as an RN, or can you get accepted immediately into the program?
We prefer you to have 1 year of experience. Now, you certainly can apply, and you can post your admission time forward. So say you graduated in August of this year, 2020, and you know, you want to apply, you certainly, you know, can. We require you to have 1 year experience only because, first of all, it gives you a background as an RN. I mean, if you're close and you're only a few months off, that's fine, but we really don't like you to jump off of, you know, finishing in the undergraduate and not working as a nurse and then just coming into the graduate program itself. We find that it really benefits you to get that background and that work experience for that.
Thank you very much. And there were 2 questions that came in from the same prospective student. I have an adult NP degree. how many classes/credits are needed to get the Postmaster's FNP?
Okay, so for the Postmasters, for the most part, if you have an HNP, you probably, I would have to look at your transcripts, but most times you have taken the role and you've taken the 3 Ps, which are your healthcare assessment, your pharmacology, and pathophysiology. So you would basically have to take the 2 core courses, the content. So you're coming in for your, I'm sorry, the
No, that's
HNP?
okay. Here, I can elaborate on the second part of the question.
Yeah.
They said they graduated in 2011 with an adult MP degree. Will their credits count towards an FNP Postmaster certification?
Okay, yes. Now, that was in, what year was it, 2003 you said?
2011.
2011. Okay, so that means that you had graduated from most likely an AGNP, so you meet that criteria. So I would have to review your transcripts. However, you probably will only need 3 credits, which are the core courses for the pediatric and OB, and then the healthcare assessment of the pediatric obstetric patient, and then 7070, which is that clinical practicum. So it's 3, 1, and 4. So like 8 credits. But as I said, I really need to look at your transcripts just to make sure, but that usually is the case.
And then I know this one might be a little bit tougher to map out, but as an applicant mentioned, I know you had mentioned the FNP program part-time would take 28 months, but if a student was to take 1 class per session, is there a maximum amount of time that they would have in order to complete the degree in the curriculum?
Usually a master's program is 6 years. You have to complete within 6 years.
And,
I hope that answers your question.
And then the one student that had the question earlier is going to email you the specifics. They are a William Patterson student or alum. So,
Sure, no problem.
But it looks like that is it for the questions as of now. So Dr. Hollema, thank you so much for your presentation. For everyone in attendance, I hope that this was helpful. Certainly, if you like what you hear, if you're interested in giving further consideration to our program, we'd love to have you apply. If you go to William Patterson University, right under Graduate Admissions, you'll see information about how to apply, and then it's just a matter of determining which of our sessions and which semester works best for your schedule to consider starting your graduate studies. I know given the timing right now, it probably makes the most sense to consider spring session 1, which begins in January, or spring session 2 that begins in March. But certainly we hope that you have the opportunity to answer any other questions that you might have in the days and the weeks ahead. You can always reach out to the graduate admissions office, and then you can see contact information for the nursing department there. Any one of us would be very happy to answer your questions. So for all of us here at William Patterson University, thank you so much for your time. We certainly know time is perhaps even more precious than ever, so we appreciate you taking time to join us for our presentation today. And otherwise, hope you enjoy the rest of the week. Be safe out there, and we hope to talk to you soon. Take care.